The Patient Protection and Affordable Care Act, or ACA, is the comprehensive healthcare reform signed into law by former President Barack H. Obama on March 23, 2010. Before ACA, many people were uninsured or underinsured in the country because of the high costs of insurance premiums and out-of-pocket costs. In fact, in a 2010 survey conducted by the National Center for Health Statistics, years before the major provisions of ACA went into effect, there were approximately 48.6 million uninsured Americans. ACA has three primary goals: to provide affordable health insurance to more people, to expand Medicaid coverage, especially to low income adults, and to reduce healthcare costs through methods such as value based payment models and accountable care organizations, which is a network of healthcare providers working together to efficiently manage patients' care by coordinating plans of care. ACA expanded Medicaid to people with income up to 138% of the federal poverty level. Originally, this expansion was mandatory for all 50 states. However, after a Supreme Court decision in 2012, this became optional. ACA also created new and regulated health insurance exchange market where people can purchase coverage and receive financial help through premium tax credits and cost sharing reductions. To be eligible for these tax credits and reductions, individuals must not be eligible for Medicare or Medicaid, not have access to coverage through an employer, and have an income that falls within 100% to 400% of the federal poverty level. Also, ACA imposed financial penalties on employers except those that have fewer than 50 full-time employees that do not offer affordable coverage. Because of ACA, consumer protections were put in place for those with private health insurance coverage. ACA prohibits health plans from denying coverage, charging higher premiums, and rescinding or imposing exclusions to coverage due to pre-existing medical conditions.
Between 2010 and 2015, the ACA expanded coverage to various demographics based on age, gender, race, ethnicity, and education. 19.2 million people under the age of 65 gained health insurance coverage. Uninsured rates fell substantially across all demographics, including gender, race, ethnicity, and education levels. 2.8 million children from birth to age 18 gain access to coverage, expanding health care for low-income families. Among those who gained coverage, 43% were non-Hispanic white, 15% were non-Hispanic black, 32% were Hispanic, and 10% belonged to other non-Hispanic groups. 87% of adults who gained coverage did not have a college degree. States that participated in Medicaid expansion saw significant reductions in their uninsured rates. Coverage expansions from the Affordable Care Act improved access to health care, reduced financial risk for families, and lowered uncompensated care costs for hospitals. While the Affordable Care Act has been integral in reducing the uninsured rate across the country despite social determinants of health, Congress was still considering a partial repeal. Following the 2016 presidential election, parts of the Affordable Care Act were up for discussion, potentially impacting consumer choice during the 2017 open enrollment period. Some people were concerned that the Trump administration would not enforce the newly available Affordable Care Act choices and were uncertain whether plan offerings would expand or be accepted. In 2017, the administration discontinued cost-sharing reduction payments for those insured through the Affordable Care Act marketplace in an attempt to reduce plan options, raise prices, and push people to leave the program. Those seeking benefits covered by Medicaid were required to provide verification of either employment or school enrollment. Those who received coverage through the Affordable Care Act continue to have health insurance but could be impacted by state and federal policy changes. The Trump administration reduced the open enrollment period from 90 to 45 days and cut outreach and enrollment funds beginning in 2018. The removal of the health insurance mandate penalties also contributed to decreased enrollment rates. Those who purchased insurance through the marketplace were covered for the 2017 plan year, but faced changes such as increased premiums and fewer coverage options. State-run markets that controlled their own marketplace, outreach programs, and enrollment periods continue to see reduction in the number of uninsured individuals.
Health insurance exchanges are essential regarding the Affordable Care Act. It is an online platform where individuals, families, and small businesses can compare, shop for, and purchase health insurance plans. Some states run their own marketplace. This would be considered a state-based exchange. Healthcare.gov is run by the federal government and considered a federally facilitated exchange. And some states are state-operated but use healthcare.gov as an enrollment platform. And this is called a state-based exchange on a federal platform. States are encouraged but not required to establish their own healthcare exchange. The role of health insurance exchanges is improving coverage, ensuring that more people can access health insurance, improving access, making insurance plans more accessible to individuals and families, improving affordability, offering plans that are financially accessible, often with subsidies, improving quality, ensuring plans meet certain quality standards, and maintaining competition, encouraging competition among commercial insurers to keep prices reasonable and improve service. Federal policy concerns would include 1. ACA legal and regulatory framework. The ACA has faced numerous lawsuits, including challenges to the individual mandate, Medicaid expansion, and contraceptive coverage. There have also been numerous regulations affecting insurers, employers, and healthcare providers. And 2, funding for subsidies. If the federal government significantly reduces Medicaid funding, efforts to let uninsured immigrants join state insurance exchanges could be at risk. During his first term, President Donald Trump pushed to repeal and replace the ACA. Kenneth Kaufman, manager and founder of a Chicago-based consulting firm focused on healthcare and higher education, fears a second term could bring an even more disruptive approach. Changes to the ACA and Medicaid on this scale could trigger a financial crisis that shakes the entire healthcare system.
Before the ACA, Medicaid was only available to low-income families, pregnant women, children, and people with disabilities. The ACA allowed states to expand Medicaid eligibility to cover adults with incomes up to 138% of the federal poverty level. Not all states adopted the expansion, which led to coverage gap where individuals earn too much for Medicaid but not enough for ACA marketplace subsidies. The Affordable Care Act introduced new regulations that affected health insurance premiums. Insurers could no longer deny individuals for pre-existing conditions, which leads to higher costs for some plans. The ACA introduced tax credits to assist lower-income individuals afford coverage. States that expanded Medicaid saw lower premium increases because high-cost individuals were covered by Medicaid instead of private insurance.
Healthcare is one of the biggest sectors in the U.S. economy. Hence, there are many industry stakeholders involved, each with their own distinct interests that often lead to potential conflicts, complexities, and significant influence on healthcare policy and decision-making. This is why healthcare policy and politics are inseparable. The government has the power to make changes in financing, delivery, and quality of care. As such, whoever controls the government has the power to shape these policies. There are numerous key variables that are constant in the political debate surrounding ACA. These variables impact healthcare policies on cost, access, and quality of care. One of the variables in play in the political debate over the impact of ACA on cost is the premium rates. Proponents of ACA argue that because there are more people insured, even the young and healthy ones, the financial risk is spread out, which potentially lowers the costs for everyone. On the other hand, the critics argue that ACA requirements, such as the caps on out-of-pocket expenses, coverage of essential health benefits, and protection for individuals with pre-existing medical conditions, increase the costs for insurers, which they pass on to consumers as higher premiums. Healthcare spending is also a constant issue in the political debate. In 2023, the national health expenditure reached $4.9 trillion, about 17.6% of the country's GDP. As such, the cost to taxpayers because of the Medicaid expansion is also an important topic that concerns policymakers. The debate over ACA's impact on access include a significant change in the number of uninsured individuals in the country, as well as the types of coverage available. Proponents argue that because of ACA, there is a significant increase on the number of insured individuals in the country. On the other hand, critics argue that the law is not doing enough for the states that did not expand Medicaid. Because ACA expanded insurance coverage to millions of people, the demand for medical services significantly increased as well. Lawmakers are concerned that the surge in demand, especially in primary care, can put pressure on an already strained existing workforce that could further lead to longer wait times and more limitation in access in underserved areas. ACA, through its many provisions, has put a greater emphasis on quality metrics that help monitor and improve health outcomes. ACA focuses on incentivizing quality and safety, as well as increasing efficiency and lowering the use of unnecessary services. Through the value-based payment models, provider reimbursements were tied directly to quality measures. The law also increased access to screenings and diagnostic testing by requiring insurance companies to cover a wide range of preventive services and eliminating cost sharing for patients. Reducing or changing the disparities across different populations has also been a constant variable in the debate over the impact of ACA on the quality of care in the country. ACA increased access by making insurance more affordable and accessible, as well as supporting community health centers that provide care services in underserved populations.
The Affordable Care Act remains a cornerstone for the U.S. healthcare system, providing coverage for millions of Americans. However, its future faces significant uncertainty due to recent political developments and upcoming policy decisions. State policymaker concerns would include 1. Healthcare provider availability. States have had to address provider shortages, particularly in rural areas, and may need to implement incentives to attract more healthcare professionals. And 2, Medicaid expansion decisions. Medicaid expansion decisions impacted access to medications, including those for opioid use disorder, MOUD. Before 2014, many state Medicaid programs covered MOUD, but coverage varied by state. Expansion led to increased use, especially in specialty substance treatment settings. These findings align with prior studies showing that access to MOUD differs by state. When the Affordable Care Act exchanges were implemented, most states either relied on healthcare.gov or participated in the state-based exchange on federal platform approach, providing minimal consumer support. However, states like Massachusetts took a more proactive stance of creating their own exchanges. Large states such as North Carolina, Florida, and Texas opted not to take control of their exchanges. From 2016 to 2019, we saw a slight national decline in exchange enrollment. As the Trump administration worked to dismantle the ACA, the elimination of cost-sharing reduction payments also led to cuts in funding for enrollment assistance.
While the Affordable Care Act has undergone changes since its inception, it has both pros and cons. The pros include reducing the uninsured rate, protecting those with pre-existing conditions, expanding Medicaid, and providing coverage for essential services. It also allows those living below the federal poverty line to access health insurance through Medicaid. It mimics universal coverage, with the government playing a significant role in setting mandates for the population. It improves affordability and promotes the use of preventive and outpatient services to enhance patient health outcomes. Even though the United States spends the highest percentage of its GDP on healthcare out of any country, there is still a substantial number of Americans without health insurance or access to care prior to the Affordable Care Act, which begs the question of what is this money being spent on? Cons include increased costs for consumer and higher government spending. Some believe that healthcare is not a right and that the government should not be expected to subsidize costs. With the uptick in those who access health insurance through the Affordable Care Act, physicians and the market were inundated, driving up premium costs and potentially reducing accessibility for everyone. Taking into consideration the pros and cons, the Affordable Care Act has been a good law as it focuses on reducing costs, improving access, and enhancing the quality of care. While it is generally believed that the Affordable Care Act has made good progress for the United States by allocating healthcare spending to more insured people rather than aimlessly spending, focusing more on preventative services, and providing coverage and access to those living below the federal poverty line, it might not be as simple as just providing coverage to more people. The Affordable Care Act has set a good starting point to expand initiatives such as outreach programs and to identify targeted areas that need additional help with accessibility and quality of care. Even though the Affordable Care Act has expanded Medicaid and provide access to low-income populations, it does not always improve access to care, as rural populations still struggle due to geographical location and other barriers.